Hello, my name is Julie Bobbitt, and I'm the Outreach Coordinator for the Iowa Geriatric Education Center. This brief video is to help family members or caregivers understand how to monitor the effectiveness and side effects of antipsychotics in a person with dementia. If you and your doctor have decided to use prescription medications, such as antipsychotics, to treat severe behavior symptoms in dementia, you'll need to monitor the impact of the medication. The first step in monitoring a medication is to clearly document the symptoms you are trying to treat prior to starting the medication. Writing things down with details can help track the symptoms and see if things are helping or hurting. How severe is the symptom? How often does it occur? What exactly is the symptom that's causing problems? What was happening to or around the person that might have triggered it? Once the medication is started, you will monitor for whether or not there is a change in the symptom. Remember, some medications can take as long as several weeks to have an impact. Immediate relief of a symptom could be related to sedation or sleepiness caused by the medication and is not necessarily proof that a medication is working. Equally, if there is not an immediate response to the medication, this can cause some people to feel like it isn't working and be too quick to increase the dose. The symptoms can be very frustrating, but these drugs take time to work. Next, you'll need to monitor the medication to see if it's causing any negative side effects. Side effects of antipsychotics can include movements such as tremors or twitches, changes in walking or falls, changes in speech such as slurring or drooling. As mentioned, sleepiness or sedation may be a side effect when beginning a medication, but it shouldn't be that noticeable after a week or two. The person shouldn't be hard to wake up or slow to respond to his or her surroundings. Also, sometimes medications can increase or worsen psychotic symptoms, such as delusions or hallucinations. Delusions are when someone believes something that isn't true and can't be convinced otherwise. Hallucinations are when someone sees, hears, smells, tastes, or feels something that isn't there. Usually, antipsychotics help these symptoms, but on rare occasions they may make them worse. Other negative side effects include a rapid drop in blood pressure upon standing, which may lead to dizziness or falls, swelling, which is most common in the legs or ankles, weight gain, and increases in appetite, high blood sugar, which can present as confusion or irritability, changes in urination or episodes of incontinence, and constipation. There are also other more rare side effects that can happen. You can see our handout on antipsychotic use in dementia to help you better understand the possible risks and benefits, and also to track side effects. It's available on our website. If you feel that you've noticed a negative side effect from a medication, contact the doctor immediately with your concerns. You should never adjust or stop prescribed medications without checking with a doctor. Discontinuing the use of some medications can be dangerous if not done properly. Finally, it's important to remember that, in addition to medication, you should continue to use non-drug strategies to manage and prevent unwanted behaviors. These are things like giving the person something to do that they enjoy, not challenging the person's misbeliefs or expecting too much for their abilities, maintaining normal routines that are comfortable to the person, and communicating in a calm, clear, and reassuring manner. The Alzheimer's Association and other groups have resources that can help you understand these strategies. We've included links to a number of these resources on our website. Monitoring the effectiveness and side effects of a medication is an ongoing process, as is maintaining awareness of the things going on around a person with dementia that could cause unwanted behaviors. By keeping a close eye on the effects of the medication and communicating with the doctor, you can help make the use of antipsychotics or other medications as safe as possible.